Hi everyone.
Hello,
Welcome
nature
to
queens.
episode 3 of Doctoring Alive with me still.
Yes.
Happy Valentine's Day.
Happy balls, my girl.
I can't relate, but how is
Why
it?
can't you relate?
Because I'm single.
Dr. David, it doesn't work like that.
Anyways, today we are going to be talking about safe sex
Yep.
and all those nice things that comes with it. I mean, if you're married, good. If you're not married, we preach abstinence. But for those of you that cannot abstain, we have to protect you. We have to ensure you're safe. And that is why Dr. Angie, who will be leading this podcast because of her past experience.
Are you sure? Are you sure you want to go in that direction?
You're the married 1 year now.
It doesn't work like that.
So I want to ask you a question. When people say safe sex, what do they actually mean?
I would say safe sex is just doing sex or having the thing in a way that would protect you, right? Because there are a lot of things to consider when someone is having sex with somebody else. We're talking pregnancy, we're talking STIs. We're also talking about the emotional aspect because, I mean, when you're sleeping with someone, when you're being intimate with someone, you're also trying to connect with that person. So when we talk about safe sex, from the medical standpoint, we're mostly talking about protecting yourself from infections.
Wow, that's new. I've never heard that before.
You're being dramatic.
But do you know that there are people that will say that safe sex is just protecting themselves from pregnancy alone, as long as I'm not pregnant. You used to see all those rules that they will say that when you go to the doctor, when you're feeling somewhere in your body and your doctor said it's not pregnancy, but it's HIV, and you're now singing, oh Lord, so
Are you
Lagbara,
serious?
you're thanking God.
So
All those
like
kind of
HIV is better than
yes,
pregnancy.
that pregnancy.
No, no. In fact, the one that I actually see a lot is by December, they will now write that 13 periods or 12 periods completed.
And they don't know their STI, they don't know their
They don't know
status.
their
So
status at all.
can you imagine?
Yeah.
So we want to talk about do condoms only prevent pregnancy or does it also prevent STIs? I think that's a common question, but there are some people who would think that, oh, I'm only using condom because I don't want to get pregnant, and because I already know my safe period, blah 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 blah. Then I don't need to use condoms. Please enlighten us.
I don't know why you want me to lead this topic, but well, I'll just do you the honors.
Thank you very much.
So, condoms,
My leader, my mentor, my superior in this
So
aspect.
condoms are actually important because they are a barrier form of contraception. So it means they prevent pregnancy from happening. But that is when it's used correctly. Because if you don't apply the condom properly, it's not going to work. If you reuse your condoms, it won't work. If you buy a condom and you leave it maybe in your pocket for a long time and then the friction thing happens and it loses its potency, when you're using it, it can actually burst. And everything will spill inside, the vagina and the
Cause
person will take it. So
pregnancy, STIs,
yes.
if you're not careful.
So if the condom is used properly, pregnancy will not happen. And another thing is when
pregnancy, but condom is not 100%.
Yeah, it's not.
But at least it's better than
just doing it like that.
And then you won't get pregnant to I think condom can also serve as a 2FA because if you can calculate your safe period, when your safe period and your fertile window is, even if you're doing it in your safe period, you can't get pregnant. But if you also use condoms with it serves as a form of 2FA.
But some people say, not me, some people say that condom reduces the pleasure.
No, so... I don't.
You're making this very awkward. You're making this very awkward, but
no. Yes. Someone will be like, no. I don't use condoms. Like, don't let's use condoms. You are clean. I'm clean.
Sweet. Yes, and it's a valid excuse.
Please,
so what would you tell them?
No, I feel you should always use condoms, and you know that it also prevents using condoms, especially if you're not married, and you kind of have multiple sexual partners. Prevent you from HPV because it forms. I mean, it's true unprotected sex, and with multiple partners that one can get that whole HPV
But
strain
you know that even
and all
with
that with condom.
condoms, you
But
can
it's
also get
limits, yes,
like
but
the
it's
HPV
not as much as when
you're
it's with
wearing.
unprotected.
Mm.
With yes, when you're not wearing. Then this all contraceptive pills and all that. Do you use them? No, you cannot use them.
Well,
I,
well, I feel like the right question should be,
mm-hmm.
would I advise someone like a woman to use contraceptive
If
pills,
she's
right?
mm-hmm.
Because people use pills for different reasons. Some people have hormonal imbalance, for
Mm-hmm.
example,
No, I'm
and
talking
they
about
need
for sex.
to take
Now
that
that this Valentine's period now and
contraceptive. Yes.
uh-huh.
Okay. So, well, if you're comfortable with using pills, because there are the side effects that happen with using pills, but it's a safe method that I'll recommend to a woman to use. But I also would educate them about the side effects of those pills, so that if at any point they become uncomfortable, they can always switch to another form of contraceptive.
Mm.
Right? Even in terms of the pills, right, there are some that are not suitable for breastfeeding moms,
Mm.
right? So we have to like educate them on which one is better for them. And there's a problem with the pill that some people do not talk about very often,
Which is
which is that there are some conditions that you have that makes it dangerous for you to use the pill. So if you've had a stroke, for example, before,
mm-hmm.
you can't use the pill. So just going to the pharmacy or going over the counter to get them is
Mm.
is harmful.
But I'm also talking about the emergency
In
contraceptive pills.
emergency, okay.
Yes, like after sex, immediately after sex, and you feel like, oh, this guy might have come in, even if he said his pull out game is the best, blah blah blah. Like, do you advise, because you know some people be like, oh no, I don't use emergency pills because of the side effects it gives
Mm.
and all that. So you rather wait and hope to the Lord that you don't get pregnant
No,
and pray
like
that God I will not do
just
it
take
again.
the
I rather
pills,
say I'll take the
right?
side effects
Yeah, just
over
take the pills.
over
As long as you
not
take
knowing.
it in the right period of time, because if it exceeds, I think 5 days.
Yeah, depending on
Yeah, depending on the brand. So, but we always encourage people to take it within 72 hours. So
mm-hmm.
if you take it after 72 hours, I'm not certain of how effective it will be. But if you take it within that window, we assume you're safe,
Yeah, even though
right?
it's not 100%, but in a way, it's also very effective. I mean, I'll choose 99% over not using anything. And I also feel one thing about the pills is that you should also, when you want to use contraceptive pills, especially after um intimacy, please be sure of the type you're using. One, you should know that they will not prevent STI. So you still have to, if you know you're not sure of your partner's status, still go get your screening done. But there are different brands, of course. You should check the expiry dates.
Hmm.
Ensure that it is
I
not
have a lot to say
broken.
about that.
Ensure it is not broken, because it can be broken and you will just say, my love, just go and buy baby things. Just ensure it's not broken, ensure the expiry, and ensure you're using the right one. If it's after a week, the you can't be using contraceptive pills after a week like that. The
Like the
effectiveness
post
has,
pill.
yes,
Mm.
the effectiveness has really gone down. So even though you are open, still investing.
Okay, so the the thing about contraceptives is, if you don't know why you're taking them, you may not
Mm-hmm.
know when to take them.
Mm-hmm.
And like there are some that you're not supposed to take. Like there's a way you're meant to take it. Like for each day in your cycle, you're supposed to take some. And there are some that do not contain the hormone. I'm talking about normal contraceptives.
Mm.
So some people skip their pills.
Yeah.
So they will skip it for like 3 4 days and then come back to it. It's not going to be as effective as someone who takes the pills every day,
Mm-hmm.
or someone who takes it as she should take it. So when it comes to the emergency contraceptive, there are people that abuse it. They take it every day, like they pop it every day.
Then they
I,
complain
I
of
would
hormonal
assume that,
imbalance.
yes, I would assume that you are not, being very cautious with yourself, because those pills are hormones, and there's going to be a lot of disruption. And when you throw off your hormones like that, your period can even become delayed, and that's another layer of anxiety. So you're not pregnant, but you're not seeing your periods. And if you're having those other side effects like the breast pain, the headaches, you're putting on weight, there's a lot going on with you.
Yeah.
Right? So the post pill is not something to pop like every
Yeah,
day.
it's
Yeah,
emergency.
it's emergency. And you
pill.
should also understand your cycle, because if you understand your cycle and you know that
Yes, you have
on
your
this,
safe
yes,
period.
there's no need
Like
to.
if your
Mhm.
cycle is a 28-day length and you had sex maybe on day 26, there is no point
Nothing is
using a
gonna,
post pill.
yes,
You're not gonna
yes,
get pregnant.
yeah.
So you have
So
to also properly understand your cycle length. If you don't understand your cycle length, just let us know. Probably we could
we can do an episode on
an
that.
episode on that.
Yeah.
Then there is this thing too about, I feel, not like I feel, I know that pineapples are going to sell during this period.
Why do you think that?
Because people, you used to see it on Instagram. People are eating pineapple. I'm going to all those reels. I'm going to my man's house, and then they are popping pineapples, cutting it.
So pineapple now be
because it will
expensive.
make them because they are going to sell.
Hmm.
Because it's going to make the taste down there smell. It's going to make it smell better. It's going to also make the taste better in that way. So, what do you really think about this pineapples whole thing? It's a myth. Let me answer it, but please add to it.
I don't know if it's a myth or not. It's not something I consciously think about. It's not something I'm very aware of.
I'm aware of it like mad.
It's not something I'm very aware of.
Mm-hmm.
But I know that something like garlic, something like onion would make that place smell not so pleasant.
Yeah.
But pineapples,
No,
not,
they'll say
I'm not really
pineapples.
sure
Like they are saying, what they are saying is, now I'm going to my man's house today. Let me buy pineapples in the morning to eat it, so that before I get to his place in the evening. Are you not aware of this? You are not aware.
I'm not certain of
What?
that. I'm not certain
So
of
they'll
that.
be like, oh, it's when you go in the evening. That when I'm going
In
to my
the
man evening, by
evening.
then I would have been smelling so good. I would have been tasting like pineapple. Is a myth. Pineapples, just take it for your own health, not because.
But are you sure it doesn't work?
It doesn't work.
Have you tried it before?
It doesn't work. It actually does not work. Let me just tell you, it doesn't work. I made a video on it last year about pineapples and your vaginal health. It does not work. It's myth. Everybody, so any medical professional will tell you it's myth. But I don't know who started that propaganda and saying no pineapples work. We are also going to talk today about flavored condoms, because I have seen it trending one time. Some condoms are actually flavored with vanilla, with pineapple, strawberry. They have the flavor strawberry, chocolate. You've seen some, Abby. Never seen
I've
that.
not
Only been on the sale this thing.
I'm not saying, but it doesn't matter.
Okay.
Yeah, we can still talk about
Okay,
it.
so those kind of flavored condoms, people are using flavored condoms because, well, what flavored condoms are for, that I know and I've read about, is it actually helps to, enhance sex. I mean, it removes that smell of the latex, so it makes it kind of smell better. But it is not all flavored condoms are actually ideal for penetration. If it's for oral sex, perfect, because when you're doing the whole oral thing, the old flavored condoms things, the smell is not, you're not smelling rubber or oil or something. You're smelling something that's kind of pleasant, so it kind of helps. And it also even helps prevent the old STI, rather than just putting your mouth direct. You using the flavored condoms could work. But what I just want to say is that some people are using, you have to be very specific of the brands of flavored condoms you use, because there are some brands that, some of them, the flavor you are using, and once you are now using it into, the man is wearing it, is inserting it, the woman is at risk of infection.
Yeah.
Yes,
I
because
was even going to mention
it
that.
disrupts the pH
Yes,
balance. So
yes.
if you are not sure of the brand, just don't use it. I also got to know about dental dams that
This episode is going to be so.
that women actually, no, not even for women alone. It's actually used during oral sex.
Okay.
And I would advise you, people, it's not really common here in Nigeria. I've not really seen it before, though I think there are some places that do
They
sell
may have
dental
it.
dams. But what dental dams does is, of course, it's like latex, some form of condom that you actually place over let's say you're having oral sex, so you place over the surface. They said we should stop using explicit words, so we place over the surface, and then you will actually give. So people use flavored condoms for oral sex, so they also call it dental dams. And so I have a way to demonstrate in case you want to do something like that during this period, you want to stay safe. How can you do the dental dams? Okay, so using a condom, it's here, it's, well, I cannot see it. I don't know how to do it, so I'll just.
Okay, so you have removed the.
So yeah, so how to make a dental dam. So men can use it for their women. Ideally, sex should be between man and woman, but that's how it should be. So.
I don't. Why are you looking at me? I'm not gonna
It's the
say.
way you're looking like, Jesus.
I'm not
I can't
judging
believe-
you. This
Judge
is
me
a safe
because
space.
This is a safe space, and
Yes.
I've traded people. Oh, what to prevent them from getting STIs, from getting the HPV strains, please. So this is it here. Angelica, help me now. Thank you very much. So you cut the down part off. Some people do cut the up
Like
part
this.
off. Yes, but you can. Some people don't cut the off part. Some people do cut the off part. And
Okay.
oopsie.
This is a live demonstration, guys.
Stay tuned.
Okay.
And watch.
So she's cutting the remaining parts into two to expose the inner part of the condom. Okay.
It's way better. I mean, this is to prevent you from getting STI.
Do you think it's cheaper than buying a dental dam, or should
Dental dam is not really common. I don't think I've even seen.
have you tried to look for one before?
No, me, I have not tried to look for one. I don't like what you're
carrying
doing.
this? You're going to this podcast.
So this is it. So you place it over your babe's area. You could lubricate the other side, but place it and then you have your pleasure to prevent STIs. And you could use flavored condoms. But if you could get the real dental dam, fine. But if you can't, you can improvise with a condom.
Okay.
So it's for oral sex.
Oh.
Some also use it for those who want to give anal sex. They also use it for that.
Look at them. They were not talking about that.
No, I'm just saying
on
it.
this
So some people are
podcast.
doing it.
Okay.
Do you have any other thing? What else are we talking about?
You know how after every Valentine period, the pharmacies are full. And for those who don't remember to take the pill,
The emergency ones.
yeah, we wait for them in the clinic.
We'll wait for you.
But some of them decide to go and do an abortion. So I think we should talk about abortions and why we discourage women from towing that part.
Abortion is illegal in Nigeria too.
Yeah,
First
for
off.
real, like
It's
it is.
illegal. But we cannot. People are doing it.
Every single day.
My own
Babies are being aborted.
Yeah. So my almost every single minute. But my own problem there is, why do people, if we know people are doing it, and it's illegal, but people are doing it, and it's causing a lot of damage. Some people are dying from unsafe abortion. Some people are getting permanently infertile from unsafe abortions. So for people, I think the only thing we do here in Nigeria is the only way abortion is legalized is if it's the baby, it's beginning to be a threat to
the
mother's
mom,
life.
yes.
Yeah, so that's why they would actually advocate for an abortion. Apart from that, it's not. I've actually met patients too who tell me that, oh, can I write a drug for them? They don't want it. Can I write drugs for them or recommend? I'm like, I cannot. I would advise you to keep the child.
Yes. Or they can even give the child up for adoption.
Adoption, yeah.
Yes. That's also something that we need to start getting used
but
to.
unsafe abortion and places where people go get pills, they don't even get them from. Do we really talk about this thing yet?
It depends on what we want to. We're not going deep. What we are talking, why we are talking about abortions is because people are doing abortions, and because they are illegal, they are being done by quacks. And anything that is done by quacks, you cannot guarantee the outcome. So even if you succeed in aborting the child, your womb can be permanently damaged. Your tubes can be blocked. And in the process, you can even develop what we call sepsis. So the woman's life is now in danger. And those are the patients that I see. People who go someplace to get an abortion done, and by the time they are coming, they are already in shock. Some of them are in coma. They are unresponsive. And at that point, there's little or nothing we can do. So why this is important to me is because I lost an 18-year-old to that, very early in my practice. And it's something I wish I would tell every 18-year-old. The pleasure that you're getting today is not worth it. It's not, because if you're going to do sex correctly, you have to protect yourself, right? So that's just the
I think that still boils down to practicing safe sex. Still boils down to knowing how to calculate your cycle length, and you as a woman protecting yourself too. If at all, abstinence is good, is key, is what is recommended. But if you know you cannot abstain, just do the needful to protect yourself, so you're not going to be sorry.
Yes. And you know how, like, when you take in and the man doesn't want the child, and maybe because of your religion or your culture, you cannot abort, you have to have that baby. You have to pause your life. So if you're in school, you have to take some few years off. If you don't have a supportive family, you're probably going to be on the streets. Yeah,
don't get pregnant.
So like, guys,
do everything. You can fight for your life. Don't get pregnant.
You just have to try to just be smart about everything you're doing around this period. And if at any point you have questions, our DMs are open.
Very open.
We're really excited to guide women, girls, boys to do the right thing for themselves and for their futures.
Happy Valentine's Day, guys. Stay safe. Stay healthy. Happy Valentine's Day. Stay safe. Stay healthy. Protect yourself. Pineapples will not make it sweet down there. What else did we talk about? We could use flavored condoms. Not all flavored condoms are for penetrative sex. I think, what else did we talk about?
Abortion.
Pills. Yeah, emergency pills to the rescue if you're not sure of your cycle length, or if you feel, you had unprotected sex or you're kind of broke and, it's not, you are on your fertile window. It's better than waiting and hoping. What else, Dr. Angelica? So
that's it for us on our
I know they used to talk about alum.
What is alum?
Alum for what?
What happened to alum? Sorry.
Don't remove it from this. Don't.
Yes, put it.
You said we should talk about alum. Please, what is alum for?
What's that about?
I've never heard of.
No. Like, go on. Like, we don't know about that.
What do they use alum to make the vagina
tighter?
Yes. And
low alum. You've not heard of some.
They also have vendors.
Nini Ola sang it.
Pussy sweetener. What about that?
Oh.
Mine is what contraceptive do men take? What's
for men?
Yeah.
Vasectomy.
Don't they go in for two? I think I'm just saying.
Vasectomy. I feel like that's extreme.
I'm just joking with you.
Currently for that, contraceptives for men.
Yeah, I don't know.
You see that this is something we need to talk about.
Yeah, for men.
Men are not taking any pills, right?
See,
so I don't think
they will not use the pills.
For men,
they will not use it.
Why would they use it?
I would use it.
It'll be like anything that will kill what is making them function as a man. They will not
use it.
I don't think it's going to kill them.
No, they will have that mental. What I'm saying is that they will have that mentality that anything that will make anything that will kill that thing that makes me function as a man. There are some condoms that actually contain spermicide.
Spermicides, yes.
So it will kill the active sperm.
Even there are some gels too.
Injections. You're going for, I don't know what it's called. You're going for your shots every 2 or 3 months.
I know that's for women. I know that's for women, but yes.
Men also take it as well.
Men take the shots. Okay. I think we'll do some research on that. Because there's a story ahead
where this guy, he took these shots and he has been dating this girl for quite a while. And he knows that no matter what happens, he can never impregnate her. So eventually she
got pregnant
and said she was pregnant.
Oh.
So he kind of felt that
she cheated.
It was a joke. So eventually after 2-3 hours, that is when he found out that she was saying that she was not joking. So what he did was like, he said, okay, no problem. That is where he knew that she cheated. So he said, okay, no problem, we'll keep the child. So what
Abstinence.
he did eventually was he traced her, and eventually he found out that she was humping someone else. And the way he handled it
What's
was-
humping? Sorry, you know when you've been saying humping, I used to think it's dry humping.
No, humping means to...
Oh,
Yeah.
oh.
Being
That's what
intimate.
it is.
Oh.
Yes, we have to watch our
So,
language.
I
That means there are
Sure.
lots of things I don't know.
At the end of the day,
Okay.
at the end of the day, he found out that she was cheating on him, and the way he handled it, I love the way he handled it. He handled it in a way that, well, I feel it's something we'll talk off camera.
Okay.
I think that's just,
Okay.
I feel there are shots for men. There are shots for men.
We'll read
Women
it.
too.
But we know we are focused on women's health, yeah?
Okay, men are not included.
All the best.
Not,
I'm just joking.
exactly,
We
but-
used to practice abstinence. Practice
Okay.
abstinence.
Okay, so
I'm
let's
just
talk
joking.
about the alum thing.
That alone, I don't understand. You know,
How does it even
heard
work?
I don't know.
I don't think it works.
It doesn't
if
work.
anything.
Low alarm. I don't know how she sang that song, but Kabedie, Sabedie, Komatite, Warikomatite. It means that you use alum under that place, you will see that it will be very tight.
So what's the mechanism of action?
I don't understand. I swear it was
But
true
do you
a
think
song
it
that I
works?
heard. I mean, I heard it. I said, eh? I don't know. You know, it's what me. I don't want to say it's what I've practiced. I used to
we
preach,
can
but
talk about.
I don't know.
To be
I
honest,
don't
I've
know
actually
anyone
not heard.
is that.
I need to start getting familiar with this.
You need to. You need to be
Because
exposed
I really
because it
have
is
no
not doing
idea.
you any good. Thank you guys. Thank you so much for watching.
You asked another question apart from
Really?
alum.
Sweetener.
What's pussy sweetness? All the songs that do not say like, my man said I was dripping. You now give me
Hey,
extra
I remember.
500k when I woke up in the morning. You know, I used to see all these things. There are
I'm
some
not
that you
asking
take,
those
maybe like
things.
gummies. There are some that, like all these Gorontula now.
Okay, yeah, I know.
Do they
about
work?
Gorantula. Gorantula actually works. Yes, it's an aphrodisiac. Yes, even chocolates too.
Dark chocolate.
I don't know whether dark or white. Some people use white chocolate.
It can be Snickers.
So I know Gorantula works because I've actually written an essay on that before. I know chocolate works. I know that these diffusers, there are some diffusers that have this aroma that evokes. Yes, and it works too.
I also
Don't
think
ask
it's
me
not
how.
psychological. Like once you do something, you just feel like, oh, it has to work for it. Because when you
Not
mention that, there are some
necessarily.
diffusers that actually set the mood.
Yes, they contain some oils
Some,
that
yeah.
stimulate the senses and all. So, but for the I don't think I'm supposed to say that word. I haven't.
They
heard
will
of that
censor it.
before. I'm not familiar with that, so I don't know how it works. But all I would say is protect yourself this Valentine's period and basically every other period because there are some things you will do now that will set the stage for the rest of your life, how it's going to be, how it's going to play out, and you have to be smart. As a girl, you have to be smart. Nobody's coming to help you if you do the wrong
I say
thing.
fight for your life.
Yes, because you can end up as a single mom and you'll be a burden to people. Everybody will start avoiding you. And if it's something that a condom can help you prevent, I think you should just do that. Yeah, I think you should just do that.
All right. Thank you very much, producers, for adding.
I feel like
to
this
our
has become
episode.
very solemn.
Thank you very much. What else do we want to add? Stay tuned for more. Stay safe.
Stay healthy, stay fabulous, and follow us across our socials at
And join the
Doctoring Her Life
sisterhood.
podcast. Enjoy the sisterhood.
Bye,
See you on our
guys.
next episode. Bye. We did say it together.
But once we're ready, go. Bye bye.
No, like
See you on the next
episode.
episode.
Bye.
Let's say it again. See you on the next episode.
Bye.
Bye.